Can you remember the first time you met Miranda?
Met Miranda quite a few years ago now. I was very, very poorly. Finding I was very tired all the time, just didn't feel right. Went to the hospital, saw lots of doctors, had lots of tests, and it was recommended by my health visitor at the time to come over to the MS centre. And I came, had a little look round, met Miranda, and she sat down, had a chat with me, talked through some of the symptoms, and she was just brilliant. You know, she just helped me kind of understand what was happening, talk through the kind of things that I might be able to do to try and make the symptoms a little bit better, and just was a support there, just to help me get over what I didn't know what was happening. I just couldn't get through a day without feeling tired and sick, and up until that point I'd been very well.
Can you remember any particular pieces of practical advice Miranda's given you that have really had an impact on you and helped you cope better with your MS?
I'm particularly bad at looking after myself, so the best advice that Miranda gave me was, you know, actually you've really got to look after yourself. You've got to drink regularly, eat regularly. She talked to me about vitamin plans, you know, sort of taking vitamin D, taking vitamin B, just to alleviate some of the symptoms. I looked at sort of alternative therapies, not just medication, because the medication I was taking was giving me side effects that were quite unpleasant.
And how often do you see Miranda now?
I probably see her less than I should. I should come see her at least every 6 months. I tend to see her when things are going badly, and she picks me up, shakes me off, and makes it all better. Congratulations
on being nominated as a super nurse in the MS Trust Super Nurse Campaign 2013. When we ask people to nominate their nurse, we leave them a space to say why they think their nurse is a super nurse, and you have tens of nominations, people saying she's very professional, an all-round good egg, she listens well, gives good advice, she's a kind, caring, exceptional nurse who works above and beyond expectations. In a word, amazing. How does it feel to be nominated as a super nurse and be so appreciated?
Well, I'm very delighted, very amazed and very flattered, and I have to say that I think probably a lot of the credit goes to my employers, because they give me the freedom to see people for as long as I need to help them with diverse issues in diverse ways, yeah, that's a wonderful thing, and to be able to, when I don't have appointments, to have my door ajar so that people can also drop in, so that's quite special.
How did you come to become an MS nurse?
Okay, well, before I worked as an MS nurse, I worked in neurological rehabilitation, so I helped to set up and to work in a multidisciplinary neurological rehabilitation team where we did rehab with people who had a stroke or a brain injury, and also with some people who had MS and who may have just had a bad relapse and needed some rehab, and that's what really gave me a taste for working with people with MS. So fascinating and a very meaty role as a nurse.
And when did you first make the step into being an MS nurse?
Well, I identified whilst I was doing neurological rehabilitation that I would really like to work as an MS nurse, and because I was already working with some people with MS, I was fortunate enough to be able to go on the MS Trust week-long residential course to learn the basics of being an MS nurse, and then I had to bide my time to see when an MS nurse post would become available, and so that was about 8 years ago, I think, maybe 8.5 years ago.
What's your caseload like? How many people with MS do you work with?
Well, because we provide a service which is open to anybody who lives in Bedfordshire or Northamptonshire, there is a membership of people with MS which is actually just over 1,000. There is a regular throughput of about 350 people a week who use the centre. But it's only in Bedford Borough and sort of North and Mid-Beds, or North Mid-Beds, where there is no other NHS MS nurse. So for those people I do provide the only MS nursing service, and I liaise with their GPs and, you know, just do the normal role of an MS nurse. But also for people who use the centre who come from Northamptonshire or from Luton area, who do have an MS nurse as well there, they can also, you know, drop in if they happen to be here, and I can help them with anything that's come up.
Can you tell me a little bit about how the therapy centre works? You have quite a multidisciplinary team.
Yeah, we have 2 full-time senior neurophysiotherapists. We have an occupational therapist whose main role is around supporting people at work. She only works a little, like fewer hours with us, but she can also work at a distance with people, so supporting them with maybe work interviews and things like that, and on the telephone. We have 3 different shiatsu practitioners who come in and do shiatsu. We have a reflexologist. We have clinics that are run by the NHS, so we have an NHS continence clinic which is here once a month. We have a dietitian who comes in and works for us but also works for the NHS. We have hydrotherapy, yoga classes, Pilates classes. We have a full-time gym instructor and a gym upstairs and volunteers who help there as well. Trying some new pain relieving methods at the moment, so we have somebody who's been employed to help with that project. We have a vast backbone of volunteers, which is fantastic, so they man the reception and help with hyperbaric oxygen and doing odd jobs.
MS is such a diverse condition for one person as a nurse to deal with. How do you help people with MS? Do you focus on one particular area, or do you deal with the whole journey, the whole person?
I definitely like to look at all my patients completely holistically. I will explain that I would like to make a full assessment, and my full assessment basically includes a history of their MS, all their medications, their mobility, their work situation, who they're living with, how they're living, all the different symptoms that MS can cause and whether that's affecting them, and then towards the end of that I like to make a plan with them, so it's proactive about actually how can we be more proactive, what can we, what could be changed, what can be done better, what can we do to help you stay well. That's the part of my work that I find really important, and obviously lots of symptom management in there. But it may be that when somebody comes to see me, they're coming with one particular issue at that time that they really need to troubleshoot. So it might be that we troubleshoot those things first, and it might be quite a while before I actually get round to doing that full assessment. So,
Could you tell me a little bit about how the MS Trust helps you practically as a nurse?
I've got to say, almost all my MS specific knowledge that I've acquired has come from the MS Trust. I cannot say how much I value the courses and the educational events and the conferences that I've been able to attend. They really have provided 100% of that core MS specific knowledge, and not only that, but if I suddenly need to get my hands on some research about a particular topic, I can pick up the phone and speak to Simon. and so also the booklets, absolutely fantastic information for people with MS, and I do give them out a lot. So yeah, I'm a heavy user of the MS Trust booklets. And the website, actually, when people come to me and they want to know about a new drug or a drug that's in the pipeline, or if I need to give good balanced advice on something which is perhaps a controversial topic or something, then right while my patient's sitting there, I'll say, well, let's go onto the MS Trust website and we'll find the latest information sheet or the latest news, and we'll actually download it and I'll print it off and give it to them. And I find that's fantastic as well, because then it hasn't gone out of date. Yeah.
If somebody sees this video on our website and thinks, I live in Bedfordshire or Northamptonshire, I'd like to come along and see Miranda, how should they contact you?
Just give the therapy centre a call. Our number is 01234 325 781. Nobody needs to have a referral or anything. Basically just need to make an appointment. We're generally met by the manager, Val, and she will spend some time explaining what the centre does and how it runs, and then on that same day you will generally come and have an hour's appointment with me where we'll just start troubleshooting on problems you want to work on, or talking about what you want to talk about. Yeah, so it's just open to anybody who lives within Bedfordshire or Northamptonshire.